In Europe, it seems euthanasia has become common practice in nations like the Netherlands and Belgium. In fact, a new report says euthanasia accounts for nearly 5% of all deaths in the Netherlands. Another approach is palliative care. That's specialized medical care to help the quality of life of people with serious illness. Dr. Christina Puchalski, director of the George Washington University's Institute for Spirituality and Health, joins me from Rome instead of from down the street. Welcome to the program.
Thank you. It's nice to be with you from Rome.
You gave a seminar this morning at the Vatican on treating dying patients, not only physically, but spiritually. Tell us your message.
The message is that spirituality, broadly defined as meaning, purpose, and connectedness to the significant or sacred, is immensely important in the care of patients, and not just dying patients, but across all of life. In particular, I'm a palliative care physician, so particularly in our field of caring for people with serious illness, spiritual distress and suffering is very prominent, and it's an absolute essential for physicians, nurses, and others on the team to attend to that suffering.
What is the difference between the approach in Europe for caring for the terminally ill and in the United States?
The approach is similar in terms of palliative care. Palliative care, in fact, was started in Europe, so the United States learned from Europe about caring for chronically ill patients. I would say in the United States we're very intentional about the inclusion of spirituality in palliative care. We have increasing numbers of board-certified chaplains that can help the team provide good palliative care. And we're working with other countries, including Europe, to try to expand that model so that people all over the world can have access to excellence in palliative care, which includes spiritual care as an essential component. But that we also recognize that we need professional spiritual care providers, such as board-certified chaplains, to help fully being present to patients and attending to their suffering.
Before we go, I know that studies show requests are increasing from people who are not terminally ill to end their lives. Tell us about that.
I think that the message of palliative care is a good message for people all over the world and in various stages of illness. And the message is that life matters and that you can continue to live even while you're dying. And if we can reframe in our culture, not just in the United States, but all over the world, that dying is a spiritual journey, then I think you won't need to ask that question, because people will find hope, they'll find meaning, they'll find their suffering attended to, they'll find loved.
Thank you so much for joining us, Dr. Christina Puchalski, director of George Washington University's Institute for Spirituality and Health.
Okay, thank you so much. It was good to speak with you.